Hello. Yes. Please sit down your full name. Okay, you only had ophthalmic nerve decompression, right?
Right.
That was 10 years ago.
Yes.
And the left side vision now is not there.
It's there, but a little bit. So
Left or right side?
Left side was the surgery.
Okay.
So I currently see mostly from my right side only.
Okay. Can you take your space? Right. So see, you have huge lesion tumor, okay? So you know it is already fibrous dysplasia. So it will need a surgery. Without that, it will get worse and worse. The fibrous dysplasia, if you do surgeries, then it will not grow again. He has fibrous dysplasia from the head till the mandible. So sometimes we cannot remove everything in one go because forehead also it is there, cheekbone also it is there, lower jaw also it is there, this side also it is there. Only this much side it is not there. This area is not there. Otherwise this full area is there. So I will try to do in one sitting, but sometimes it might need 2 sittings. Because
When you say one setting, you are talking about removing everything.
Everything I might be able to do in one sitting.
Like,
Or
you might need to open for that.
That
I have to open for that.
you are telling about that some glass words are used.
What's that?
That bone.
No, I have to open your skull and remove all the bone, cut everything off.
This here.
Yes.
Actually, I was not looking for removing everything. Majorly, I am concerned with this part only where it can be removed.
If you do not, it will keep growing.
Currently, no. We went to endocrinologist. He said mainly due to elevated levels of alkaline phosphatase and other bone formation levels, my bone grew on top of my normal tissue.
Exactly.
So he suggested some zoledronic acid.
But once it has grown, no medical treatment solves this.
Understand that.
You will need surgery to correct it.
But it's not growing more. That's what I'm.
Yeah, because you finished your growth.
Correct.
So therefore it will not grow aggressively. But if you remove it, it will not grow at all. And it is looking abnormal now in the whole issue. So there is no purpose retaining such a big thing here and removing small things here. I don't understand the logic
So
of that. You will,
without any issue.
yeah, without any issue only. I will not cause any issues for you.
And there will be no scar.
No scar will be there. No.
And
Nowhere on the face.
this and it will not affect any other.
Nothing will affect. If it affects, I will not do surgery for
And
you.
actually, one more thing, he is not.
I will not even give you scar on the forehead. Nowhere you will get scar. All the extra skin that you have on this, I will remove from back. Here, the full bone will be removed. There will be no scar that will be visible. And your forehead shape, your eye shape, everything will become better. No side effect will be there.
Which bone will be removed?
Lesions.
Front side.
Full bone, that bone will be this much thick. Have you taken the scan recently?
We have an MRI.
2012,
No,
22.
22 is good. Yes, 12 is too old.
Yeah, we have done the surgery.
I will show you on this how thick the bone is. You don't have the right cards because you have to take a CT scan.
I think CT and MRI both are mixed.
No, there is no CT. Yeah, I mean this I can show you a little bit. So, See, all this is bone. This is his brain. Everything is a bone. Normally, the thickness of this bone is like this. Okay. This has become so much extra for you.
That's the forehead.
Yes, the forehead, full thing.
Hmm.
This is right from the forehead till the eye. Is the eyes.
Yes.
Just above the eye, all the way. Even your sinus is full of bone.
Actually, he is not able to smell.
That I cannot do anything.
That maybe that is the
Because of the
compression.
tumor, because it's compressing.
Compression.
Yeah.
Because of that.
That we will not be able to solve. I will not cause.
Nose, rhinoca, you will see that nose also.
Yeah, we can see the nose also. But what I'm trying to say is, when you remove, this is all so much thick. This much thick it is.
Okay.
1.5 inches. So we have to remove everything and leave only a small bone like a normal thing. We can do that.
Without any issue, we will.
Nothing you will have. No issues with that. We can correct that. I've had many patients who had more severe cases than this that we've treated. You can check leontiasis ossea, other craniofacial fibrous dysplasia cases. It's all.
I was actually looking for another open surgery after 2019. That's why.
The choice is yours. If you don't want any surgery also, you are free to go. I'm not here to force you.
No.
I am here to give you the good opinion, and then the rest is yours. Even if you don't choose a surgery, it's your choice.
But
You may choose.
everything will be even after.
I can tell you what is
correcting.
possible. Nasal smell, your father said. I cannot do anything for that. Right? What I can do, I can do. If you want it, then we go to the next level. If you don't want it, that's
No,
fine.
we wanted actually how to correct this.
If you want only the maximal, only the cheek, that's also possible. But it's not a good idea for you. You will have to go through the pain, have to go through the anesthesia. Why would you want to remove a small piece and remove the rest? When the rest also can be removed with no extra risk.
This cannot be removed without an open surgery.
Nothing can be done without open surgery. Everything is an open surgery.
As
This I will remove from inside the mouth. This, if you want, I will remove from inside the mouth. This I will remove from the head. The approach will be different such that there are no scars on your face. But everything is an open surgery. Nothing can be done without open surgery. For you, should not be done. Benefits are not there. I will not do. For me, a fibrous dysplasia, craniofacial fibrous dysplasia, this is the way you treat it. And any other treatment modality like is not worth the stuff. Alkaline phosphatase, all of those things. I'm not the specialist to give the medical treatment. You can do that, but still you need a surgery to get the deformed face back. And also another thing I have seen in patients, I've had a patient who was in his 40s. Tumor didn't grow for a long time. Again, it can grow suddenly. And when it grows, then suddenly you can have problems with breathing, you can have problems with the eyes, with vision, with everything. When you remove the bulk, that chance becomes less. Because fibrous dysplasia is a lesion that works like that. So, once removed, that's the end of the story. It will not come back again and create problem for you, and especially because it's a craniofacial variant. So we could do
So
that.
you're suggesting whatever is visible here, we will do everything.
My suggestion will be to remove as much of the lesion as possible, so that you get the best improvement and the best chance to avoid a functional issue in the future. Once a functional issue develops, I cannot solve that. You can try and prevent it in fibrous dysplasia. For example, if the thing swells and goes and obstructs your nerve, then once it does the damage, we cannot solve it. Before it does the damage, we can remove the tumor and finish it off. So that is like the thing which we can do now. Is there a surety that tomorrow it will cause nerve damage? No. There are some patients who have lived 50 years and no nerve damage. Others have had problems also. And you have already had a problem. So this is not something you can predict correctly. Wherever you go, even if you do a lot of scans, it's very hard to predict these things. The surgery is a major surgery. it needs expertise in craniofacial work. Hence,
We came here for that.
hence some of them may not want to do it. It's not a simple thing. So the risks are there for that. But we can do this and solve your issue.
No issues.
Nothing will, you not get any other extra problem. Whatever you are having currently, only that will remain.
This one, we just consulted back in Pune. What he said was, while removing this, there might be a numbness in the nerve which might be permanent. That's why he was suggesting your name.
Oh, the doctor asked you to come here?
Yeah.
Actually, our Pune doctor has
Dr.
suggested.
Pushkar Wagnis was there.
Oh, Pushkar Vaknis asked you to come here. Oh,
Yes,
okay. He's a very good friend.
the highest hand to.
Oh, I didn't know. Okay, he should have told me first only.
Yes.
I was there in Pune a few months ago with him.
He only suggested
Ah.
because Dinanath we normally go for whatever issues are there. So we consulted him. He said you are the best hand and best to do that.
You can do it, no problems.
Here,
Nothing
while
should
doing this, my teeth and any other,
See, the nerves will come out through this area. Okay. So we will preserve the nerve and only do the surgery. I won't remove the nerve. If you remove the nerve, then you have permanent numbness. So the technique is to preserve the nerve and remove it.
Correct.
It's a little bit more difficult, but we can do that.
because it's here from might be 10 years or so, it was slowly growing. I was not.
Everywhere the same thing. Here also you have nerves.
Hmm.
Here also you have supraorbital nerves. So the whole objective of the surgery is to retain the nerves and remove the bone. Because it's not cancer.
Correct.
If it is a cancer, then we remove a whole resection. Everything will be removed. Skin, muscle, bone.
When we
But yours is not
got
that.
that left eye decompression,
Yeah.
they have taken that what is that called? Test. It was not a malignant disease.
It is not malignant.
No
It's,
malignant.
fibrous. It's a classical fibrous dysplasia. It's not malignant. So therefore, the chances that you get permanent numbness is very, very minimal. You will not get, because we will not resect it, like how you will do for a cancer or how you will do it for something else. It will be what is called as a cosmetic shave.
Correct.
Your case, debulking. These are the words we will use. We will not use the word of resection. So resection means all these things will happen, but these things will not.
So we can also combine rhinoplasty with this. These surgeons.
No. This itself is too much of a surgery. Rhinoplasty is a cosmetic surgery, we can keep it for later.
Okay.
If you ask me, we should try and remove as much of the lesion in one go so that
We'll come.
it's easier for you, pain and everything. I generally don't operate more than 6 to 7 hours. So in that much time, whatever we can remove, we will remove.
We'll go for one.
That's better for you. Just consider. So we can remove this, and majorly this in one go. And then you wait for 6 months to 1 year. After 6 months, you can do rhinoplasty anytime. Because I'll be removing bone around here also, wherever. I'll be taking some more scans. When you are ready for surgery, then I'll make the plan. So we will be working on almost entire face except this part. The whole thing. Even nose I'll be working on because there is a tumor on the nose inside. I've seen on the scan. So I will remove that so that that shape becomes slightly better if possible.
But you'll only cut from this part.
No, nose will be clearly inside the nose, inside the mouth.
You're saying you'll do here all
No scar will be there on your face. No scar will be there on the forehead.
no scar, but how many cuts will you do in my face?
Plenty.
20.
Yeah. Maybe one on this side, 1 year, 2 here, one inside. This will be a full cut like that across the head.
Okay.
Nothing you have to be worried about.
From here directly we can.
No. No. It is extending till here. Can you see? On the scan, it's extending till there. So, can you see? So they have done some surgery here.
That is the decompression.
Exactly. So I will be doing it like this.
Okay.
Open the full thing up. Remove all of this bone. This bone, eye, on top of the eye also will remove this, everything. Then we move on to this side. From here I'll come till here. Then this inside the mouth will go till here. So this one from inside the mouth, from here to there, from the head. Then from inside to the nose, from inside the mouth and inside the nose. All this is bone. Then this side not much. Here like this, inside the mouth again. So all
This
of
will not affect even teeth and other things.
nothing will affect. Show me your teeth.
Here, that both inside.
All that will be corrected without affecting the teeth. You know, to see how much it's swollen.
So that inside.
I showed you. So all of that only is Ramon removes teeth. Right? See that? All this is yeah. This, lower, all this will be removed. But the teeth won't be removed. Teeth won't be removed and I won't remove the nerve, nothing will be done. All those things will be done.
Because this was touched to my teeth, upper teeth.
Yes.
So no issues in teeth rebalancing.
Nothing.
Like when it's removed, nothing will happen to my teeth.
Nothing will happen.
Stay like that.
It will stay like
Everything is.
your teeth will be fine.
After, like, let's say we do the surgery, how much time does it take for recovery?
So you'll have to stay here for about 10 to 12 days. We plan 2 weeks. Total recovery will be 1 month.
Post surgery.
Yes. What kind of you studying or working on it?
I'm IT professional.
So IT means you can take 2 weeks leave.
Okay.
If you have to work behind the computer, you can work after 3 days also.
Okay.
But
He can work from.
but better to take leave. It's a major procedure because we will be
So at least 1 week we can take leave.
more only is better.
More.
Yeah. We will be also doing your bloods. We might be prepared for blood transfusion, everything. So you have to be prepared for a longer stay. And I think better to put 2 weeks, 3 weeks leave, safer. Because see, dietary restriction also will be there. And this is not a, what should I say? It's not exactly a cosmetic surgery, it's more of a reconstructive surgery. Hence, it's better to just take leave. And 1 month is too long, 3 weeks you need. Because we will take 12 days
Full recovery.
for even suture removal. Yeah,
2 weeks.
2 weeks. Then plan 2 weeks. Because you know, the first day we may not start surgery. We have to do some more scans, we have to do blood tests, we have to do so many other things. That'll take a day. Next day we can do the surgery.
And once you are doing here, this again there will not be any.
No, it will not grow again.
No, I'm not worried about scar as it's such.
The scar won't be there
I'm more
also.
of worried about my other functionalities. So
Nothing will happen to your functionality.
Everything will be.
That is, I've already told you clearly. No function on your face, on your body will be affected. Neither the function of sight, nor the function of smell, eating, chewing, nerves, sensation, nothing will be affected permanently. Everything will be affected for a short while. You will feel numb for a few weeks because obviously working around the nerves, but it's all going to come back.
Okay. And the skin that went inside, so it will be everything will be going inside like this. Like after surgery, no?
No, that is because they removed the bone from there. We will have to remove some skin also. So that because now the bone is grown by 2 inches. So his skin has stretched. When I remove the bone, I preserve the nerve, but I remove the skin to tighten it. Otherwise, you'll only lose here. All part of the surgery. I do it from back. So we tighten it. We redrape the skins on top of this. If you have insurance,
We have that.
so you can tell them before, and most of them will give. Fibrous Dysplasia gets covered, but we don't have insurance here. like cash free. So you'll have to make the payment and get the reimbursement done later on. That's something you can talk to your HR or whatever, make the plan.
Doctor, approximately 12 days we have to be here.
Yes.
If it is surgery,
Yes.
around
Yes.
approximate cost will
They will tell you the costing outside.
Sure.
Then you can make a decision.
Sure.
Okay.
We'll talk here only.
Yeah.
Just give us a little time. You will be taking a call now only.
Yeah, you can talk. There's no hurry. Talk and
Now it's
that's your mom?
Yes. Actually, my elder son was traveling. He was to come. He wanted to come and be here when we talk.
Nothing will happen. Don't worry about this.
He was worried about that only. If you remove.
There is a patient I'm remembering now. Just Google. Just put lion face and Sunil Richardson. You'll get many articles about this guy. And this was time to see UK. Chip away and cheap in the lion face. We can check this. This is one such severe case. Apart from that, we've done many which you can see on YouTube also. But the Leon case actually involves the cheekbone and involves the forehead as well. And in your case, it's involved not bilaterally, not both sides, it's involved one side. Okay. Even the sinus is involved in the right side. The scan, full of bone. Right side.
Because of that, I think maybe the smell was also affected.
Yeah,
Compression.
it is because of that. But once it happens, generally we cannot give it back. That's why I'm saying, because fibrous dysplasia is such, we cannot
Strong smell, I think he is able to
get it.
get it. Very strong smell. Normally, he is not.
Alright, sure. Yeah, right.
Give us some time. We are here.
Sure. You can talk to my staff, you come after lunch, you can talk.